Right, so what I'm going to mix here is zinc phosphate. It's really important that you look at the actual name on the back and don't look at the manufacturer's name, because that manufacturer's name is Duralon. There's loads of zinc phosphates out there, it's the same thing. Again, make sure you're not pushing it down on the pad and do it from a height to get your first drop. So I'll do a consistency first of all. Say if we were cementing a crown on. Do you normally do 2 for crown or 1?
1.
Again, shake your powder and then tap it down just so it loosens it up, and then use your pointy end of the spatula. Again, that should be put on an angle and then you separate it into sections. You can add your first section with the pointy end. So I'm going to do a mix for mixing and cementing a crown, and then I'll thicken it up and show you what a temporary will look like. So you can just lose a little bit more. Just make sure you incorporate everything, and then what you can do, always put it on the end of the pad. It's easier for the dentist rather than doing it in the middle. Then you can just hold that under the patient's chin, and then that's a nice consistency for the dentist to put in the crown. He'll gather it up, or you can do it on the end and then just drip it inside the crown. Right, I'm going to thicken that up now. So if a patient needed a temporary and it's on a back tooth, we're just going to make this really thick, and then the dentist will just pack it over the back tooth, and that should last for a week or 2. So again, use the flat end to move more powder in. More powder again. Really push it down, it should hurt your hands when you do this as well. Then you know you're getting a good mix. So again, just a slight bit more. You can either leave this on the pad, or I'm going to put the powder back in here, but using the flat end. Let's get that out of the way. What I like to do with this is just wet my fingers slightly and then just roll it up. It doesn't stick to your gloves then. You can either pass it to the dentist like that and he can use his flat plastic, or you can just leave it like that and then he can just gather off whatever he wants. If he wants to put it in 2 sections, he can do that, or just roll it up and use his fingers. It'll be like a putty then. Okay.